Hi, my name is Richie Daniel. I'm a student physical therapist from Campbell University. Today I'm going to be performing the Cozen's test. The purpose for this test is to check for lateral epicondylitis or epicondylalgia. So to perform the Cozen's test, the therapist stabilizes the patient elbow in 90 degrees of flexion with one hand palpating the lateral epicondyle. The other hand positions the patient's hand into radial deviation and forearm pronation and into wrist extension. The therapist then applies a force to bring the hand into wrist flexion and ulnar deviation. According to Newman, the common proximal attachment site of the wrist extension is on or near the lateral epicondyle of the humerus and dorsal border of the ulna. The distal attachments of the extensor carpi, radialis longus, and brevis are the second and third metacarpals respectively. These muscles are responsible for wrist extension and radial deviation. The extensor carpi ulnaris attaches to the fifth metacarpal and is responsible for wrist extension and ulnar deviation. With tendinopathy, any stretch or contraction of the tissues can potentially reproduce pain. The starting position of the test, which is elbow flexion, wrist extension, radial deviation, and pronation, places the muscles in a shortened position. The combination of resisted contraction and palpation of the origin of the muscle reproduces the patient's symptoms. Alright, Nate, so Nate's our patient today. So I'm going to check for a lateral epicondylitis in your hand, okay?
Okay.
Alright, so I'm just going to place one hand over here underneath the elbow and the other hand right here on your hand. Okay? So
Okay.
all I want you to do is make a fist. Good. Now lift up your hand and then point it towards your chest. Excellent. And now what I want you to do is just resist my force.
Okay.
Okay? So you can see the contraction of his extensor muscles over here. And right now Nate has no pain, which indicates a negative test.